in CHCs, in PHCs, we are going for a compulsory screening of patients who have got regular cough. And that handheld machine tells us if there is any abnormality. And when there is, because of AI intervention, and when we detect that there is some abnormality, it goes for a further test and then the treatment starts. The another initiative which we have taken is that we have introduced a shorter regimen for the sensitive, those who are sensitive to the medicines. They get what we call it three fixed dose combination, fixed dose combination for 2 months, for 3 months, and then 3 months they get the fixed dose combination of 4 medicines. So in 6 months we are able to the patient healthy, and we are able to eliminate the tuberculosis part. But there are patients who are drug resistant. So for them, the medicine used to carry was to continue for 12 months or 12 to 24 months. Now it has been reduced to 6 months, where we call it B-PaL M regime. So that regimen is what we are introducing. So burden भी कम हो रहा है और patient friendly भी हो रहा है. So this is what we are trying to bring. Another thing is that we have increased the financial support from 500 to 1,000 per month per patient. And because it's not only the medicine, we give free medicine. Even if it's a private doctor who is treating, the medicines are given free. So medicine part is not only there, but we also give them the 1,000 rupees per month to see to it that they take good diet. And we have also introduced a Nikshay program where lakhs of people have come forward and they give us financial support. We make a basket of protein and other things so that the patient takes, and not only the patient takes but the family takes, because generally they are poor family members, and it's not only the patient who needs good diet, it's also the family members who need it. In the TB Mukt Abhiyan, we had a 100 days program. This was the second, TB Mukt 2.0 for 100 days. और इस TB Mukt program में हम लोगों ने aggressively campaign किया, और aggressively campaign में we also detected asymptomatic patients. Like I'm all right, I'm healthy, but I may carry tuberculosis virus, and it may affect the person who's little weak. So that also happens. So we detected the vulnerable populations, like slums, like factory workers, like workers who are working in a small room, all working together, very close contact. तो ये सब vulnerable groups को हम लोगों ने detect करके tuberculosis में, because as much we detect tuberculosis patients, we will be able to treat them and we will be able to eliminate the disease. So this is how, these are the things which we have taken, which we have initiated, and things have been, we are in that direction to go forward. One thing more, what is the expectation from you all? The Ministry of Health and Family Welfare has circulated a circular where we have asked all the district magistrates, the chief medical officers, and the medical superintendents of the hospitals to see to it that whenever a public representative is there in your hospital or visits the hospital, you ensure that all documents and all informations are supplied to the elected representatives, so that they can review what is going on, how you are working. So my request is that your active participation, first of all, in your respective states, I would request that you should have a sensitization program for all MLAs. At least in your constituency, you can ask your MLAs, 5-6 MLAs are there. If you can sensitize them, that will work. Then, to the public, the PRIs, what we call the Panchayati Raj institutions. So if you sensitize them also, and we have asked that in all camps, the member of the parliament and the member of the legislative, irrespective of any political party, he has to be taken into confidence, invited, and he should or she should participate in the camps which are taking place. So, what I request is that you, in your respective districts, should contact the district magistrate, tell him loud and clear that, or tell her loud and clear that any activity related to tuberculosis is happening. You should give me prior information, intimation, so that I can make my program conveniently and I am present there. And you, as the representative of the Government of India, as a public representative, have got the full right to review, see, participate, and see that how you can support the cause of the elimination of tuberculosis. So this is in general, which I have talked about. In more details, Aradhana Patnaik ji is going to give a presentation where all details are going to come. But this, I wanted to give my introductory remarks that the purpose of your being present here and your active participation is certainly going to help the humanity at large and in eliminating tuberculosis from India.